Welcome to the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation and the Optometric Education Channel. Today's episode is Evaluation of Clinically Centered Microbiology and Immunology at Coursework on Student Perceptions and Learning Outcomes. I'd like to thank our host and topical editor, Keshia Elder, and topical expert, Daniel Taylor. Now, on with the show.
Welcome back to the American Academy of Optometry Foundation Clinical Podcast Series. I am your host, Dr. Keshia Elder. I am a fellow of the American Academy of Optometry. I am joined by a fellow, Dr. Daniel Taylor. He is also a diplomate of the Optometric Education section. So, hello, Dr. Taylor.
Hello, Dr. Elder.
So thank you so much for joining us today. So let's begin by you just telling us a little bit about yourself.
Yeah, so I did my optometric education at Southern College of Optometry, my hometown, Memphis, Tennessee. So it was a great place to spend 4 years. And then I liked it so much, I stuck around for another decade or so as a resident and then also teaching before I took the opportunity to move up here to Michigan, to Ferris State University, Michigan College of Optometry. And I've been there here for 5 years now, serving in a variety of roles, but currently as interim dean. So I'm just thrilled to be here and thrilled to be with you today.
Right, so thank you so much. So today we're going to spend a few minutes talking about an article titled Impact of Clinically Centered Microbiology and Immunology Coursework on Student Perceptions and Learning Outcomes. This is hot off the presses. It is in the current issue, the Winter-Spring 2023 edition of the Journal of Optometric Education. And this paper was written by Beckler, Lewandowski, Nova, and Costin. I just messed that up. I'm so sorry.
That's okay.
So I'm going to say, okay, so I think you're fine. Hopefully she can cut and come back to me. Okay. So let's go ahead and get started with what we're going to discuss today. We're going to talk about a journal titled Impact of Clinically Centered Microbiology and Immunology Coursework on Student Perceptions and Learning Outcomes. This is recently published in the Winter-Spring 2023 edition of the Journal of Optometric Education. The authors are Beckler, Lewandowski, Mava, and Costin. All right, so let's go ahead and get started, Dr. Taylor.
Absolutely.
So, thank you. So let's just start by you giving like a quick summary of an overview of the paper.
Yeah, sure. The paper is about the concept of vertical integration in education. And just summarize that very briefly, it means that instead of teaching all of your basic science foundation and then coming back a semester or a year later and teaching all the implications of that clinically, you teach them at the same time. You organize all of your basic science concepts around those clinical implications that you know that your students are going to see one day when they start seeing patients. And so this often, if you've heard about problem-based learning or case-based learning, right, this is normally the way, those are vertical integration methods that are used to make students think about the clinical element of what they're learning from the very beginning. And so what has been found is that when they do this, they tend to learn, have more satisfaction with what they're learning, but also they tend to learn it more deeply. They tend to understand it better, appreciate it better. And so the reason why optometric educators should be very interested in this topic is because this has been used to great success in medical school for quite a while. As we find our scope of practice expanding, as we have more medical elements to what we're doing, it may be necessary for us to find ways to present the same material in more efficient and effective ways so that we have time in our curriculum to move on to other elements as well. So by experimenting with vertical integration, that may be a really interesting way to do that.
That's a great, summary of this paper, and also makes me think this is a little bit tangential, but students always, when they come to school, they always say, well, the basic science courses, how are they relevant? I don't see the connection between what we're learning and what we're going to be doing, but this is a great way, if done properly, that can actually show immediately that clinical relevance to that basic science that they're learning. So that's what I love about this concept.
Absolutely.
So when you kind of think about the paper overall and what you kind of got out of it when you read it, how do you think this may potentially influence the approach in optometry schools, how we provide basic science education?
Yeah, I think what it shows us is that students do like this. They do appreciate it, right? That was some of the implications or conclusions of the paper that I thought were really well done. Students like what they're getting out of this. And there's significant evidence in the medical education literature that shows that this, as we said, leads to deeper learning. So because of that, it's not unreasonable to make similar changes at the optometric education level. And so this study, as well as additional studies that basically demonstrate that optometry students are no different from medical students, the same methods that worked well in medical school work well on optometry students as well. More studies like this will hopefully provide the impetus for optometry schools and colleges to implement more of this vertical integration in their course materials. Because, of course, we want our students to learn things deeply. The challenge is that takes a massive, what's the word I'm looking for? It's a massive commitment.
Yes. Oh my gosh. Yes. Yes.
And so that requires institutional buy-in from all levels. And so the better and the more studies we have that demonstrate its effectivity, the easier it is for decision makers, for faculty members, for everybody involved to buy into the concept.
So this is very similar question that I just asked, but how do you think that the findings of this article can help us as educators change how we deliver our optometry education?
Changing how we deliver optometric education,
or maybe influence it a little bit more,
Yeah. Like if we were just to think about, get away from the mindset that my job in this class is to teach biochemistry, or my job in this class is to teach anatomy, or even vision science, because all of these things are useful and interesting in and of themselves. But we know that the vast majority of our students are there to become clinicians. So if we start thinking about what our students want to get out of it, and then we ask the question, how do I present the material in a way that is likely to get the students where they want to be and where our program wants them to be? This is why it's so useful to set up really good learning outcomes, not just for your classes, but also for your overall program. If you know where you're going, then you can ask the question, am I taking the right steps to get there?
Right.
Instead of just throwing information at the students and knowing or trusting that they'll figure it out, we now ask, can I lead them in a pathway that is likely to get them to where they're trying to go?
Perfect. And that kind of has me thinking about one thing that I found of note in this article is when they stated that those clinical lectures and those questions from those clinical lectures were predictive of overall success in a course. It made me really appreciate how when students can really understand the clinical correlations or the clinical implications of those basic science concepts, how that can help show how they really understand that foundational material.
Yeah,
I just thought that was just.
It does. And I know that there's great evidence in the medical literature that implies that going through this helps you to become a better clinician. One thing in this particular study that I noticed was that the way that they demonstrated that correlation between those clinical-based items on tests and overall course grades was, just comparing that as a correlation coefficient, which is fine, but we do want to be careful. Because if you look at kind of what they did, there were 120 questions that the entire course was based on, and about 30 of those, give or take a few, were clinically correlated. Well, if you take 30 questions out of 120 just randomly, and you compare them with a correlation study with the whole thing, you're probably going to find a pretty strong correlation. So that doesn't necessarily mean that these clinical questions did not have an effect, but just that we may need some more robust studies. Like, for example, a study with a control group here would be incredible. And so maybe that's the next step. Now that we've kind of introduced the topic, maybe we can do something where we compare a control and an effect group and see what kind of effects that has on the overall outcomes of the course.
No, I absolutely agree. That is the one component that I kind of missed, that I was like,
Yeah.
well, how was it before? What did they think about? So I absolutely agree that if we do have that control aspect of that study, that can give us some more robust findings, with those outcomes. So thank you for that.
Of course.
So looking at this paper, do you think there are any key messages that you think your colleagues would care about?
Yeah, I think if we really are interested in making the best clinicians we can, then we should be striving all the time for deep understanding. We should not just be satisfied with a student getting most of the right answers in a multiple choice test, where we know that if you're any sort of a student at all, you can usually narrow it down to 2 and you got a 50-50 chance of getting the right answer. So because of that, we should not simply say that's good enough. We should be striving for something more. And vertical integration, making everything that clinical oriented focus, creating those clinical themes, like for example, in this case, a microbiology or immunology class, asking the question, not just what does the book say we should learn about microbiology, but how does microbiology and immunology, how do they impact clinical practice? And let's start from those impacts and work our way back.
Right.
That kind of thing leads, I think, to more interest among students, like you talked about. So that first year, they're not saying, what am I doing here? I thought I was here to learn about eyes.
Why am I here? Yes.
Exactly, right. And then second, too, it also forces them to work through things and makes them better clinicians. I think that the medical literature is clear on this subject. And so the assumption, of course, is that optometric students won't be any different. So it's really that focus, I think, on what do your students need to get them where they're going to go? And let's start designing our assessments and designing our course material, our course presentations in ways that are likely to get them there.
Right. And I think that's the one thing that can be so challenging for us as optometric educators, because most of us aren't trained educators. Most of us are more, subject matter experts. And then we kind of get these positions because we want to teach our students, but we don't necessarily have that training that we may need, that foundational educational training. So I think a lot of times some of these lifts, the things that we need to do to make these changes just seem so overwhelming. So I think it's wonderful that things like the optometric education section exists, for those students who are, those colleagues who are interested in learning how they can be better equipped to educate, their students. So that's just like a shout out to the optometric education section.
Thanks a lot. We do pretty good work.
Yes, you guys do some great work, actually. So I'm going to end with this. So what are some things that you could think, some potential research routes that can come from this paper, you think?
Yeah, I think the next obvious step, we kind of talked about one already, and that's a control group or something that gives a little bit more robustness to the claim that these clinical questions actually lead to our predictive of good outcomes. Some more robust clinical study there is probably very useful. But what I'd also love to see is somebody who has a background in instruction or instructional design writing up how to do it. Right. One thing this article really didn't get into, it said that we did it, but it didn't really talk about the process. There's a really good paper by Malik and Malik that was published in 2023. If you search that and the subject of vertical integration, you'll probably be able to find it. But this is out of the medical literature, and they give 12 tips in there for how you might go about vertically integrating your curricula. And I won't read them all, but there are things like you got to invest in appropriately training your teachers, all the people who will be presenting. They got to know what the method is. They've got to know what the philosophy is, why you're doing the things you're doing. You got to decide, if you're going to do the whole curriculum or just a portion. One interesting thing is if you're going to do just vertical integration, or you're also going to do horizontal integration.
Okay, right.
Horizontal integration is the idea of, instead of teaching one course that's immunology and one course that's microbiology, you teach just an overall basic science course that goes from subject to subject when it's appropriate. And then if you take that horizontal integration, where one day they might be learning micro, one day they might be learning gross anatomy, one day histology, and then you also vertically integrate it with clinical care, well, you're really getting somewhere, because what you're doing is you're approximating what it is to be a clinician. When
Right.
you go into the room and you don't know if you're going to have a contact lens case or
Right.
refractive case or disease case.
Right.
That's the way we practice. So that's probably the way we should learn too.
Right.
So I think in the future, somebody who can really break down, okay, optometrist, optometric educator, you want to do this. What are the steps you need to go through?
Right.
And I'll tell you, Dr. Elder, the one thing that I think could really derail interesting actions like vertical integration and optometry is a bunch of people doing it badly.
Oh my
if you do-
gosh.
You know what I'm talking
Yes.
about?
Yeah,
Then it
absolutely.
gets a
Yes.
bad reputation, it fails, and everyone says,
Mhm.
that vertical integration
doesn't work.
stuff, it
Right.
doesn't work. Well, hold on, we never really tried it. So let's make sure we do it right the first time. We go through the appropriate deliberative steps, and I think we'll find some pretty good results.
Gosh, that's this, this conversation is just so interesting to me because I just kind of think about optometric education as a field and
Mhm.
with the decreased amount of literature that we have just for optometric education relative to, medicine in general or dentistry. There are just so many things that we have the ability, to kind of study and learn more about things that can positively impact how we, educate our students. So it's just exciting to kind of think about these things, the potential things for the future for us.
Absolutely. And if you're out there listening to this and you think that sounds cool, but it's a little scary, I don't know where to start, just reach out to your friendly neighborhood member of the optometric education section of the American Academy of Optometry. We love talking to people about these kind of things. We'll be happy to take you by the hand.
Absolutely. And I can't think of a better way to end this particular podcast. So thank you, Dr. Taylor, for spending some time with me today to talk about the impact of clinically centered microbiology and immunology coursework on student perceptions and learning outcomes. So it was a pleasure talking to you today.
A pleasure, Dr. Elder. Thank you.